Hello. I would describe the communication between the patient and the provider as very, very superb, and very stoic, very standoffish. The provider rudely interrupted the patient when she was trying to tell them how she was feeling, his symptoms, as well as when the provider, when the patient mentioned that she'd had a rough week and the provider did not even, zone in on that or ask more questions, pretty much trying to build an interpersonal relationship between the provider and the patient. Now, that right there would have been a great segue or a key component into why the patient is there, why she is experiencing this pain. That leads us into the second question, or how that interruption kind of detracted the provider's information gathering. I think it did. It really, how can you diagnose something that you don't have all the information about? And interrupting the patient, she never got a chance to circle back and say, oh, and what I was going to say earlier was this. And that right there could have been the key. That could have been the key component into, what she was experiencing. Or the fact that when she said that, she was having a rough week, that would have been also a great segue into asking more questions. But when when the provider interrupted Miss Jones, the patient, she lost her train of thought, and we would never know what she was gonna say after that. Now the students, what they learned from that whole scenario, to me, I feel like what they learned is that it doesn't really matter what the patient has to say. You are the provider and you make the final call. Now, that could be all good and well, but you could really be misdiagnosing the patient because you never got to gather all the useful information that you need to be able to diagnose them. There are a lot of symptoms that one can experience, and all it takes is for one simple or one differential symptom that could, set them apart from either having cancer or having, diabetes. And I know that's such a total, apple to oranges description, but that's how important allowing the patient to, really voice their opinion, and then making sure that you build some kind of rapport with them where they actually feel like, oh, you are listening or you really care. So, those young doctors right there, or those student doctors right there, are going to end up becoming attendants that think that, it doesn't matter what the patient has to say, as long as you gather the answers to the list of questions that you came in with. That's all that matters, and then you make the diagnosis. And we all know that that's not good. Describe how the provider's nonverbal behavior communicated his status and his role. Very, very good question. Now, it makes you feel like you are the alpha. It makes him feel like there's this certain level of superiority. Like he has all the answers. Like it doesn't matter what you have to say. Perfect example was when he asked if she had had abdominal surgery, and she said no, she hadn't. And she asked him, does the provider think that she needs surgery? And the provider just answered with a no. No, what? No, can you explain? They could have explained why they said that. So it was, a lot of the answers were yes, no's, kind of like, oh, I don't need to explain myself to you. I don't need to, give you more information, even though I'm asking you information that is putting fear into you. Next question. What verbal communication from the patient would you like to have expanded when she said she was having a rough week? That right there could have been, again, I said earlier, the greatest segue into, or the greatest key into what is actually why she was feeling the way she was feeling. Having a rough week could be that, she was moving and she'd been lifting things, heavy items all week, and now she's in total pain. It could be something as simple as that, or maybe she's been depressed, or, maybe she lost a loved one, or it could be any single thing. I wish the provider had expanded on that, so we'd really know, why she was having such a rough week, and that could pretty much help us put two and two together and trying to figure out if that had anything, if there was any kind of correlation, correlation between what she was feeling and why she was having a rough week, or why her week was bad. What verbal communication from the provider would you like to change? Him not explaining why he was asking all these questions. Like I'll go back to the example of when he asked her if she's had abdominal surgery. If I were to be asked, oh, have you had abdominal surgery? I'll step back and be like, no, why? I wish he had explained why he was asking certain questions about her urine. Make her understand. Don't just act as though she's, ignorant or oblivious to simple information. This is her health. It's good for you to help her feel involved, in the decision making of how her health plan would eventually pan out. Identify 3 or 4 behavior, verbal or nonverbal, that could help to enhance an interpersonal relationship between the two of them. The provider could be very, very, very more empathetic. Ask questions about how she feels. Listen more. Explain yourself and your questions. Explain why you're asking these questions. Explain why you're doing what you're doing, not just throwing things out there and expecting for the patient to just roll with it because you are the physician, the alpha. Why is an interpersonal relationship important in a patient to provider interaction? Because that helps you. It makes your job so much easier. It makes the patient feel relaxed. It makes the patient feel like they're being heard and that their provider actually cares for them. And it makes your job as a provider a whole lot easier. You get to identify key points and key questions that you can ask and get to make good diagnosis.